provinces with a view to setting up a vaccine, and our frequent conversations with the provinces and territories will not stop there. Last night, we announced that on the 10th of December, next Thursday, we will once again meet with the premiers to discuss the pursuit of our combined work against COVID-19, the work on healthcare, and the preparation of the distribution and logistics for the vaccines.
Will be a national endeavor, and as such, Canada is collaborating with provinces and territories, Indigenous partners, and private sector partners as well to ensure the appropriate planning and infrastructure is in place to receive and distribute the vaccines. These discussions are not new. Discussions with provinces and territories have been ongoing for many months, in fact, since May, on details of a potential vaccine rollout. Members of the Canadian Forces, as the Prime Minister announced last week, have begun discussions with provinces and territories to ensure a coordinated effort for the delivery of the vaccine. Our Team Canada approach will ensure that when a vaccine is ready and approved as safe and effective, everyone can access a COVID-19 vaccine as seamlessly and as effectively as possible. Our support for Canadians has not once wavered, nor will it as we head into the critical coming winter months. So with that, I thank you very much. And now I'll turn to my colleague, the Minister of Health, Patty Hajdu.
Thank you very much, Minister LeBlanc. And first of all, let me just start by saying today is World AIDS Day, and it's the beginning of Aboriginal AIDS Awareness Week. And it is a good time for all Canadians to learn more about HIV, to protect themselves and their communities from the infection of HIV, and to reduce HIV-related stigma. And Health Canada actually recently just approved the first HIV Self-Test Kit in Canada. This 1-minute self-test allows people to see if they have an HIV infection through a single drop of blood in the privacy of their own home, with advice on the packaging for what to do next if they test positive. And this was actually created through an investment in research in HIV testing technologies here in Canada. Now, as Minister LeBlanc said, we continue to prepare for Canada's immunization campaign for COVID-19. And so far, $285 million has been allocated to distribute COVID-19 vaccines to Canadians. Yesterday, we received an application from Johnson & Johnson, which is our 4th application, one of the first, if not the first country in the world to receive that application. In fact, Canada's regulators are highly regarded around the world. We're considered gold standard regulators. That means that we are watched closely by other countries that don't have as robust of a regulatory system for indications of safety. And companies themselves know that we have an attractive and trusted regulatory pathway, so this speaks highly to Canada's regulatory system. We're also working with other countries' regulators to make sure that we can share data and analysis. Obviously, the world is seized with trying to analyze the data coming out of manufacturers as quickly as possible. This really ensures that we have a coordinated response with other countries as well. Canadians can be sure that whatever Health Canada approves in terms of vaccines will only be done when it's entirely safe to do so. And our work with provinces and territories on the distribution side is ongoing. And the plan is shaping up very well. So I say to Canadians, hang on, we can get through this winter together, and relief is on the way.
Patty, thank you very much. And now we'll turn to our colleague, Minister Anita Anand. Anita?
Merci beaucoup, Brad.
Thank you very much, Dominic. It's a pleasure to be here with you all.
About PPE, tests, and vaccine rollout. As we heard from yesterday's fall economic statement, our government has taken unprecedented steps to keep Canadians safe. Our plan is, and always has been, to protect the health of Canadians, jobs, and the economy. We are accomplishing this through aggressively pursuing contracts with a variety of suppliers to meet and indeed exceed current needs and to prepare for the future. Premièrement,
First of all, personal protective equipment. I am pleased that we have obtained more than 2 billion pieces of personal protective equipment, and more than half of those have already been shipped.
over 40.5 million rapid tests, 3 times the total number of tests performed in Canada since the pandemic began. And our government continues to gain access to the most effective treatments for COVID-19, such as Eli Lilly's and Abcelera's antibody treatment. In short, we have conquered the PPE procurement challenges and the rapid test procurement challenges, and vaccines will be no different. Turning now to vaccines. We all long for a return to normal, and the only way out of this pandemic is through following health and safety measures and continuing to pursue a vaccine. À cette fin,
To this end, we have acquired the most diversified portfolio of candidate vaccines in the world. We have agreements in place to obtain up to 414 million doses of the 7 most promising candidates and up to 15 supplementary doses thanks to the international COVAX initiative.
Canada is very well positioned in terms of its vaccine procurement. In particular, I wish to address some misinformation. Despite misinformation to the contrary, Moderna has publicly confirmed that Canada was one of the first countries in the world that it signed an agreement with for its vaccine candidate, and indeed has stated publicly that Canada is at the head of the line for its vaccine doses. Second, Pfizer has publicly confirmed that Canada was the 4th country in the world with which it signed an agreement. Third, Canada was the first country without large-scale domestic capacity to secure a bilateral deal with AstraZeneca. Pending regulatory approval, vaccine doses will begin arriving in the new year. And I wish to say that I am personally engaged with a variety of suppliers to ensure that deliveries take place as soon as possible. Moving now to vaccine rollout. From a procurement perspective, Canada's rollout plan has 3 key components: regulatory approval, distribution, and administration. On regulatory approval, Minister Hajdu has stated that Health Canada has now received applications for approval from 4 of the leading vaccine candidates: AstraZeneca, Moderna, and Pfizer, and Johnson & Johnson having applied yesterday. This process is proceeding well, and we should remember that Health Canada, as a regulator, is the gold standard of regulators among the world and will ensure that a vaccine is safe and effective before we roll it out to Canadians. The integrity of the regulatory process is fundamental to the healthy and safety existence of Canadians. Moving now to distribution, the second part of our rollout plan. De plus,
Moreover, we have bought freezers with the capacity to store the most promising vaccine candidates, particularly from Pfizer and Moderna. We have now received 38 of these freezers and recently ordered 92 more for a total of 126.
I'd like to repeat that as despite my public comments about this procurement, this is another area where there has been significant misinformation. I will therefore reiterate in English that we have purchased 126 cold and ultra cold storage freezers with the capability to store the most promising vaccine candidates, namely Pfizer and Moderna. We have received 34 of these freezers and we have 92 more on the way. Together with existing federal capacity, we can store 33.5 million frozen and ultra frozen doses of vaccines. In addition, a request for proposal issued by my department to 4 pre-qualified bidders that could help with end-to-end logistics for vaccine delivery across this country closed this past weekend. We anticipate having contracts in place in the coming days. I will return to publicly announce those contracts. Finally, the third phase, administration. We have known all along that this vaccine rollout would be crucial and complex, not to mention a massive undertaking, which is why we did not wait to act. Because of our early action, right now, we have a sufficient supply of syringes, needles, gauze, swabs to accommodate 25 million doses of an administered vaccine, with many more supplies en route. We also have contracts in place for additional supplies to administer additional doses should the needs arise. To conclude, I would like to reiterate that I and we as a government will not cease in our efforts to ensure that when a vaccine is ready, le Canada sera prêt aussi.
Canada will be ready as well.
Merci beaucoup.
Anita, thank you very much. We're now going to turn to Dr. Tam and Dr. New. Dr. Tam.
Good day, good afternoon. Bonjour à toutes et à tous.
Good afternoon to all.
378,139 cases of COVID-19 in Canada, including 12,130 deaths. Nationally, there are over 66,000 active cases across the country. And over the past week, laboratories across Canada have tested an average of over 74,500 people daily, with a 7.4% testing positive. Yesterday, just over 6,100 cases were reported nationally. In addition, there were over 1,750 new cases reported for Saturday and Sunday. This brings the average daily case count to close to 5,800 cases for the past week. The number of people experiencing severe illness continues to increase. Over the past 7 days, there were on average over 2,250 individuals with COVID-19 being treated in Canadian hospitals, including over 450 in critical care, and an average of 87 deaths were reported each day. Today marks World AIDS Day, a day where global community comes together to remember those we have lost, to honor what has been achieved, and to recommit ourselves to the work that remains to be done. This year, I am reminded that like COVID-19, the health, social, and economic impacts of HIV have been felt to a greater extent by some. We know that COVID-19 and the public health measures implemented to slow the spread have had an impact on the availability of sexually transmitted and bloodborne infection prevention, testing, and treatment services, including harm reduction services. Despite these many challenges, there are still places we can turn to for hope. While there is no vaccine against HIV, there are highly effective treatments. Individuals living with HIV who are on treatment and maintain a suppressed viral load cannot transmit the virus to their sexual partners, which is otherwise known as undetectable equals untransmittable, U equals U. I am also encouraged by innovations, such as the recently authorized HIV Self-Test, that is an important additional tool for improving access to testing in a safe and confidential manner. None of this would be possible were it not for the efforts of community leaders, researchers, health providers, and peers who see to it that those most in need are not left behind during these challenging times. At this time, let us take inspiration from them and do our utmost to protect our families, friends, and communities by doing our best to maintain individual protective practices while supporting others who may be struggling. It is safest for all of us to limit errands and outings to just the essentials, limit in-person activities to just our existing household members, and keep up with key prevention practices. Stay home if you have symptoms, practice physical distancing and frequent hand washing, wear face masks in indoor public spaces, and avoid the 3 C's: crowded places, close spaces, and close contact situations whenever you can. Thank you. Merci.
Bonjour à toutes et à tous.
Good afternoon, all. There have been 378,139 cases of COVID-19 in Canada, including 12,130 deaths. Nationally, there are over 66,000 active cases across the country. Over the past week, labs across Canada have tested an average of over 74,500 people daily, with a 7.4% testing positive. Yesterday, just over 6,100 cases were reported nationally. In addition, there were over 1,750 new cases reported for Saturday and Sunday. This brings the average daily case count close to 5,800 cases for the past week. The number of people experiencing severe illness continues to increase. Over the past 7 days, there were on average over 2,250 individuals with COVID-19 being treated in Canadian hospitals. Today marks World AIDS Day, where the global community comes together to remember those we have lost, to honor what has been achieved, and to recommit ourselves to the work that remains to be done. This year, I am reminded that, like COVID-19, the health and social economic impacts of HIV have been felt to a greater extent by some. We know that COVID-19 and the public health measures implemented to slow the spread have had an impact on the availability of sexually transmitted and blood-borne infection, prevention, testing and treatment services, including harm reduction services. Despite these many challenges, there are still places we can turn to for hope. While there is no vaccine against HIV, there are highly effective treatments. Individuals living with HIV who are on treatment and maintain a suppressed viral load cannot transmit the virus to their sexual partners, which is otherwise known as undetectable equals untransmittable. I am also encouraged by innovations such as the recently authorized HIV Self-Test. That is an important additional tool for improving access to testing in a safe and confidential manner. None of this would be possible were it not for the efforts of community leaders, researchers, health providers, and peers to see to it that those most in need are not left behind during these challenging times. At this time, let us take inspiration from them and do our utmost to protect our families, friends, and communities by doing our best to maintain individual protective practices while supporting others who may be struggling. It is safest for all of us to limit errands and outings to just the essentials, limit in-person activities to just our existing household members, and keep up with key prevention practices. Stay home if you have symptoms, practice physical distancing and frequent hand washing, wear a face mask in indoor public places, and avoid the 3 C's: crowded places, closed spaces, and close contact situations whenever you can. Thank you.
Dr. Newton. Thank you, Dr. Newton. We're obviously now ready to take questions.
We'll begin with the telephone questions.
Plus une question de
You'll have one question and one follow-up.
first few questions. As a reminder, one question, one follow-up. Operator, off to you.
Thank you. Please press star one at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. Our first question is from Christy Kirkup from Globe and Mail. Please go ahead.
Hello, good morning. Can you hear me okay?
Yes.
Please go ahead.
Okay, great. Thank you very much. I'm wondering if we can please look at the federal health transfers. Specifically, is your government willing to commit to increasing the federal health transfers as demanded by the premiers ahead of the First Minister's meeting?
Minister LeBlanc?
Sure. So thank you for the question. As you know, our government has committed many months ago at the request of the premiers to have a discussion on healthcare, on the healthcare elements of supporting Canadians, obviously in the context of the pandemic, but looking at a way to have a sustainable long-term basis for healthcare. So we announced yesterday, I announced yesterday, I think the Prime Minister did as well, that meeting will take place next Thursday on the 10th of December. So we're looking forward to that conversation with Canada's First Ministers. Obviously, we're going to take stock of the public health emergency facing the country now, the supports necessary that have been put in place collaboratively with provinces and territories to support healthcare and public health measures, not to mention the economic measures necessary to support Canadians and Canadian businesses. But that conversation will be happening next Thursday on December 10th. And we approach that with a lot of good faith and the spirit of collaboration, which has defined all of the conversations we've had with provinces and territories since the beginning of the pandemic last March.
And just as a follow-up, Minister, the economic update says that all federal transfers combined jumped from 72 billion last year to 99.7 billion this year, but it's projected to drop to 82 billion in 2021-2022.
As I mentioned in my opening comments, $24 billion that we've transferred so far to provinces and territories directly related to measures required in the context of COVID and the public health emergency, things like contact tracing, testing, and other measures, long-term care measures, other measures necessary to support healthcare systems across the country. We've also said to First Ministers that and I think we're seeing across the country, the depth of the second wave, the challenge facing the country in terms of the second wave and the difficulties in every part of the country that governments and health authorities are having in terms of meeting the needs of supporting their populations in the second wave. So we are always available and always willing to talk to provinces and territories about their needs next year in terms of measures to support Canadians during COVID-19. But the discussion of how to support a long-term sustainable public health system, which is a priority that we share with all governments across the country, will be very much the subject of the discussion we're looking forward to having with premiers.
Géron de l'agence QMI. À vous la parole. Oui, bonjour.
Good afternoon. My question is also for Mr. LeBlanc. Yesterday, when you announced that the meeting would take place on the 10th of December, you didn't directly mention the transfers in French. You were talking about a range of subjects. And for the premiers, is this uniquely a meeting concerning healthcare transfers? Or do they have the impression that you're trying to drown this in amongst a bunch of other subjects? Well, no, we're not trying to drown out the conversation on needs in the healthcare system. We are looking at the state of the healthcare system in Canada in the context of the worst pandemic that's taken place in 100 years. So to have a clear conversation with the provinces and territories on the future of funding for the healthcare system in Canada, I think we also have to start the conversation with a discussion on the current state of the fight against COVID-19. What can we continue doing together with the provinces and territories? The importance, for example, of having a logistical strategy for the vaccine, which it seems will be coming in the next few weeks. So all of this necessarily is part of the findings that we have on the healthcare system across the country. But we've never hidden the fact that we will also be prepared to discuss with the premiers the future of transfers and the financial situation of the provinces and of the federal government in terms of the support for healthcare in this country. So all of this will be part of discussions. I can't imagine that will be anything but friendly and collaborative as it was before the beginning of the pandemic. Follow-up? And the request for an increase in healthcare transfers, that existed before the pandemic. And it was exacerbated with the pandemic. Of course, they are looking for more money. So I don't understand your logic saying that we have to start the conversation talking about the current fight against the pandemic. Well, once again, the situation of the pandemic has necessitated extraordinary investments on the part of the federal government. And we will be supporting healthcare measures. We never talked about the cost, for example, of obtaining all of the vaccines that my colleague Anita Anand referred to earlier. It's the federal government that will ensure that these vaccines are free to Canadians. And since the outset of the pandemic, my colleague at the department, the Minister of Finance, set out yesterday for the necessary expenditures related to COVID-19, including in their healthcare system. So one doesn't take away from the other. If we could have discussions with the provinces on the future of public health care, we are going to begin with the findings of the hundreds of billions of dollars that the federal government has already spent in terms of available supports to Canadians and for the healthcare system. But we're completely open to discussing with the premiers, as we have said from the beginning. If we have had 22 meetings to date with the premiers of the provinces and the territories, and during many of these meetings I was present, we also discussed the importance of healthcare transfers, and that's why the Prime Minister accepted that we would have this meeting next Thursday. Thank you.
Pour deux questions.
We'll move to the room.
2 questions, and we'll head back to the phones afterwards, time permitting.
Hi, Mackenzie Gray with CTV News. This is either for Minister Anand or Minister Hajdu. In the U.S., the Secretary of Health, Alex Azar, said, and this is a quote, "Within days of FDA approval, we'll start seeing vaccines in people's arms." So in a bid to avoid misinformation, which Minister Anand, you pointed out, seems to be an issue that your government has with what we've reported, can you give us a clear timeline on after the vaccine is approved in Canada, how long it will take for shots to be going into people's arms?
Well, thank you very much, Mackenzie, for the question, and I'll just say this to Canadians. We will begin immunization when it's safe to do so, and we are working actually hand in glove with Procurement Canada and with the manufacturers, by the way, around the world who are also eager to get doses out to Canadians and into the arms of Canadians and, in fact, world citizens. But this is a very delicate dance. We need to make sure, first of all, that the vaccines pass regulatory approval. And as I said in my remarks, Canada is a gold standard regulator. We're respected around the world for our regulatory process. First of all, because it's smooth and it's fair, but it's also a standard of safety, which in fact many countries look to when they're doing their own approvals. Secondly, we're working with regulators from other countries, including the FDA, the EU, the UK, to make sure that we can share data and share our findings of that data as quickly as possible, because of course that helps accelerate approvals for all of us. And thirdly, we're working with the provinces and territories to be able to receive shipments of doses as soon as they become available from the manufacturers. And the manufacturers, of course, have timelines for deliveries as well. So we're in a good shape. I will say this, Canadians are in good shape to receive early doses and, more importantly, I think safe doses of vaccines when they're available.
And Minister Anand, do you have anything to add on that?
Sure. The crucial point for delivery dates is the date of approval given by Health Canada. Then our delivery processes kick in. And you will recall that I have said this repeatedly, as has my department when asked. We knew when we put these contracts into place back in August that there was going to be a question relating to when Health Canada approval would be forthcoming. And that's why our delivery schedules are based on delivery windows or timeframes as opposed to one specific date. That's the prudent way to contract. You understand that there is uncertainty in the future. You put the contract in place and you continue to negotiate in terms of when deliveries can precisely occur within a given time frame based on Health Canada approval. And that's exactly what we're doing. And the reason why we've been able to secure the most diverse portfolio of any country in the world and the most number of doses per capita of any country in the world is because we were aggressive in our contracting with Moderna, with Pfizer, with AstraZeneca, so that we could put Canadians in the best place possible for vaccine distribution once Health Canada approval is forthcoming. That should not be forgotten. Our priority is to get vaccines out to Canada, but we will only do so once we are told by the regulator that these vaccines are safe and effective. And I believe that is exactly what Canadians expect of their government. And that's exactly what we will deliver on. Thank you.
In terms of who gets the vaccine, I think there's broad-based agreement that elderly Canadians and frontline workers should be at the front of the line to receive it. But for Minister Hajdu, once we get past that point, do you envision it being the federal government who decides who gets the second or third or fourth decision on who receives it, or will it be the provinces? And for Dr. Tam and Dr. New, what populations after elderly and frontline workers do you think should receive a vaccine in the early stages of distribution to ensure the best COVID outcomes?
Well, thank you very much, Mackenzie. I'll start, and I will turn to the doctors because they've worked extensively with the National Advisory Committee on Immunization, who has actually given us a broad buckets of priority populations, who should receive it first, all with the goal of saving lives and stopping the spread. That is the entire goal of the prioritization process. And so I'll just say this, at the national level, these are recommendations, and then they are further shared with provinces and territories, who will then have to refine those prioritizations based on their own processes. That's the work that Dr. Tam is doing with the Special Advisory Committee, and so I'll turn to her to speak to those negotiations.
It's the provinces who will make the decision, correct?
At the end of the day, it is the provinces who deliver health care, and it is the provinces who will decide on the priority populations. And of course, we're working closely to make sure that we have coordination across the country and that we agree on the principles, which in fact we have. We have a shared set of principles now as a country across provinces and territories with the federal government. And finally, I'll just say there are also some federal populations that we will obviously have to take care of ourselves as the federal government.
Yes, so we have, and I think the chair of the National Advisory Committee on Immunization has done some communications already. What that committee would do is once the data is being made available, for example, to the regulator, we will be getting hold of that information, because what you need to do is to see the exact data in terms of the age groups, the safety, and the efficacy information. And so each of the vaccines may have similar but slightly different groups of people that they've got the data on. So that's really important as the first step. So then the prioritization will take into account the epidemiology of who's at higher risk and who may be at increased risk of transmitting to those higher risk, which is the sort of preliminary set of priority groups that the NACI has essentially already published. What we're going to be doing right now is getting more granular with the planning for the delivery to those specific groups. After that, I think what one might envisage is that the age groups, for instance, that's the easiest way to think about how to prioritize the population outside of high risk and those who can spread to those at high risk. And also, we're also obviously prioritizing those in high risk settings and remote and isolated areas. And discussing with First Nations, Inuit, and Métis leadership on their priorities. But then the age group is, based on all analysis, is actually the easiest and the most scientifically sound way, I think, of increasing the population coverage post that time. We know that underlying medical conditions puts people at high risk, but when we actually analyze all the different underlying medical conditions and the age, it still comes out that the age is in fact the most important when you look at severe illness and mortality. So some of those will be, sort of discussed. Kids haven't really been engaged in a lot of the clinical trials. So that will be another age group for which data is needed. And we will be looking towards more data on pregnant women as well.
Hi everyone. David Thurton, CBC News. Thank you so much for joining us in person and virtually. Really appreciate that. Minister Anand, I just wanted to follow up on my colleague from CTV's question. You were talking about windows for delivery. Maybe I missed it, but can you specify what the timeline for delivery, what that window looks like? Is it a week? Is it 2 weeks? I know you can't give us a date, but can you be more precise about what that window looks like after we see a safe vaccine approved?
Most definitely, and thank you so much for the question. I want to begin by reiterating that at the current time, the delivery window is within the first quarter of 2021, and that is based on Health Canada approval that we hope is forthcoming. But of course, we as politicians do not have input, nor should we, into the regulatory process. So at the current time, we are looking at the first quarter of 2021. That's the delivery window. But as I said, I am negotiating with our vaccine suppliers every day for earlier delivery dates. And so when that Health Canada approval is forthcoming, we will kick in to the delivery process ASAP. That's why we have the refrigerators procured. That's why we have the syringes and the needles and the gauze procured. And that's why the conversations are occurring with the provinces as we speak, so that as soon as Health Canada has provided its approval, we are well placed to begin deliveries to Canadians as soon as possible.
So just a follow-up and then another question. Are we to assume that the delivery window is 3 months after a vaccine is approved? Because is that the window we're looking at? And then I have to ask a question about prioritizing who gets this vaccine. I know you just said that it's the provinces that will ultimately decide, and you have shared principles, and those shared principles seem to be based on age. But I'm also wondering what your shared principles say about people who are working in grocery stores, who are cab drivers, who are bus drivers, who tend to be low-income, racialized, quite vulnerable and quite hard hit from COVID. So, Minister Anand, if you could just clarify the window, is that a 3-month window? And then if you could answer my second question, Dr. Tam, that'd be great.
Sure. I understand the desire for the greatest possible specificity around the delivery dates because we all want to see an end to this pandemic, and we believe that the vaccine is perhaps one of the ways that we will emerge from this pandemic on the other side. I feel that, you feel that, we all feel that. So I want to add, though, that while there's pressure to move at the speed of politics, we will not rush the science because our top priority is the health and safety of Canadians. It is not possible to circle a single date on the calendar, but I can assure you that as soon as Health Canada approval occurs, our delivery process will kick in and we will make sure that vaccines are coming early in the new year. This is built into our agreements, and I am personally and actively engaged with a number of our suppliers to ensure that this happens as quickly as possible. I want to take you back to the beginning of the pandemic when there was an urgent need for masks, for gowns, for gloves. And at that time also, I told you and all Canadians that we were putting in place contracts for the supplies of these goods, and we would issue out these goods to Canadians as soon as we possibly can. We have since procured over 2 billion items of PPE. We climbed that mountain. We then moved on to rapid tests, and we've procured more than 40 million rapid tests for Canadians. The vaccine procurement is occurring now, and we will climb this mountain and we will succeed. But we need to be cautious in terms of receiving Health Canada approval. And we don't want to provide misinformation to Canadians in any way, shape, or form. Thank you. I'll turn it to Dr. Tan on the rest of.
So amongst the principles being agreed upon are principles of equity as well, not just the scientific information. And so, but the National Advisory Committee's 4 key groups already encompass some of the populations that you're talking about. So those in long-term care and the elderly and those who work with them, healthcare workers who work with patients who are direct contact, but essential services. So these are not just health services, but other essential services, which could certainly include those who provide food and other essential services. But also the 4th group are those whose working or living conditions put them at higher risk. So people in congregate living situations or congregate work settings and others will be considered some of the first priority groups. And then, of course, as I said, age will then come into play subsequent to that. But those 4 are the key first groups. But even amongst those, we're trying to be much more granular now in terms of as implementation goes along. Well, who's in the first month, say, or thereafter? So that detailed work is being taken very seriously by the provinces and territories as they begin to plan their immunization clinics.
Thank you. We will now turn to the phone for one last question. And in a follow-up, I would ask that we keep answers tight because we are hoping to end not much later than 1. Thank you.
Thank you. Our last question is from Tonda McCharles from Toronto Star. Please go ahead.
Hi, thanks. If I could ask, I'm not sure if this is for who this is for, so I'll just ask. Given the fact that you rolled out rapid tests to the provinces and many were slow to deploy them. Could maybe, I'm not sure who, maybe Dr. New, since you're involved in vaccines, or can you talk about the challenges you see ahead for the provinces, and to what extent, what will the federal government be in a position to do for some of those provinces who might face some greater logistical challenges, say, than others? Again, I don't know who that goes to.
Well, Tonda, hi, it's Patty. Hi, I'll start, and then maybe I can turn to Dr. New and Dr. Tam for some more specifics. But I'll just say this. It's really important to remember that provinces and territories have a high degree of experience in immunizing people. Yes, there are some novel immunizations coming, Moderna and Pfizer most particularly, that require really cold storage and temperatures and delicate logistics around transportation. But provinces and territories have, every year they undertake a massive immunization program called the Influenza Immunization Program. And in fact, this year, more than 16 million people immunized in a short few weeks. And that just speaks to the fact that they already have systems in place, they already have capacity in place, and they already have processes in place. And so we're building on that to support this process. You know, not all the vaccines will arrive at one time. And in some way, that's a blessing because we have time to unfold these vaccines, as Dr. Tam said, in an orderly fashion, prioritizing at the very beginning those that are prioritized by the advisory committees that we all have. And then, you know, as further vaccines are approved, that we are able to distribute them through more traditional ways. So I think the top line I want Canadians to know is that their provinces and territories already have sophisticated immunization programs, and the federal government is here to help with that, where they're here to help, for example, with these extraordinary vaccines that require extra equipment and new processes, and also any other support that the provinces and territories need along the way, as we've demonstrated throughout the pandemic. We'll be there if they have other glitches or other challenges or other delivery challenges, or even other administrative challenges.
This is Teresa Tam. Just to add from the Canadian Armed Forces, we have detailed bilateral discussions with each of the provinces and territories because they're all quite different in terms of the requirements. So there'll be meticulous mapping of the logistics, etc. So I think that the federal government support would be most important for those vaccines that require specialized handling. So that's why that's been put there. But as Minister Hajdu said, the provinces and territories do have significant experience in general with immunization programs and clinics.
And it's Dr. New, I think the last thing I would add is that we started our first, and I think in a series of sort of technical briefings in terms of the vaccine rollout. There was the one last week that was focused on the regulatory process and procurement, and there's another one scheduled for this week, and it will focus on logistics. So I think we can get into a sort of a more granular detail at that tech briefing. Thank you.
Last quick follow-up.
Yeah, and I guess want to understand, perhaps for Minister Anand, yesterday the fiscal update summarized that the federal government to date has spent $13 billion on COVID medical research and vaccines. There was also a reference to having spent $1 billion on vaccines. I'm really not clear on what so far to date, if you're not prepared to release the contracts, have you spent on the 7 contracts that you've, what's the total? If you could give me that, please.
Thanks so much, Tonda. We have invested more than $1 billion so far to secure up to 414 million doses from our 7 vaccine suppliers and to secure Canada's delivery dates early on. We've also invested $284.2 million to bolster our capacity to distribute vaccines. For example, secured freezer capacity at the federal level in order to store 33.5 million doses of the Moderna and Pfizer vaccines falls into that category. So those are the numbers that we are utilizing with our 7 vaccine contracts. Thank you.
Thank you, everybody. This puts an end to our press conference for today. Merci à tous. Ceci met fin à notre conférence de presse pour aujourd'hui. Bonne journée.